Yeah, I think it's all right. All right. We probably so hi everyone, and welcome to another Facebook, Instagram, and now YouTube live session. And this is our session number 34 that I hold now every Sunday evening at 9 p.m. Brisbane time. And tonight, part of my workplace health and safety series, I will be talking about how can you help yourself in times of increased anxiety, especially due to the coronavirus pandemic. It's surely a very stressing time for everybody, and I'm here to share a little bit of my experience and how am I tackling this potential issue. But first, for those that don't know me, my name is Gerson Ida. I'm the founder of www.engineersinaustralia.com, a website to share content of value and useful information to help you in professional engineering recruitment. And some people don't know, or maybe a lot of people don't know, but I'm actually a qualified mental health first aider. But Gerson, what is a qualified mental health first aider? Well, someone trying to identify and provide some support to people suffering from some sort of a mental health. I've completed my training this year, and it was really, really useful. And I'm accredited for 3 years now to provide, to identify and provide some support to people suffering from mental health. And we'll see that anxiety is one of the mental health issues. So let's get down to the business now. And I received some material at work that I thought it's worthwhile sharing with the broader community, as the current situation is certainly creating an environment conducive to anxiety. As you probably know, I work for the Department of Transport and Main Roads, and as part of our support to the employees, we receive some information about workplace health and safety, obviously. And this week or last week, we received some information about health anxiety. And then I thought about sharing this information with you guys, because it's certainly something that's is very concerning and needs to be addressed. So global epidemics, public health warnings, and the outbreak of a disease like the current coronavirus can sometimes appear really, really frightening. And while these feelings are understandable, if they start to interfere with your everyday life, you may be experiencing health anxiety. So some could be asking, what is health anxiety? Well, health anxiety is a mental health issue characterized by feelings of worry, anxiety, or fear about your health and well-being. And some of the symptoms include stress that's out of proportion to the impact of the event, and inability to set aside a worry or feeling restless. But what are some of the signs and symptoms of health anxiety? Well, in response to the coronavirus, you may be experiencing some worry and anxiety, feeling of helplessness, becoming withdrawn, or even avoiding public places, which now is probably a good idea. We talk about physical distance. We don't talk about, we need to still keep in touch with people, either telephone calls, WhatsApp, video calls, etc. But also you could be hypervigilant about health and hygiene, and even confusion, especially when you're getting information from so many different sources. People with elevated health anxiety might experience severe anxious thoughts that interrupt their daily life. And there are some common symptoms of anxiety, and they include difficult in concentrating, restlessness, rapid heartbeat, trembling or shaking, feeling lightheaded or even faint, numbness or nausea. You could be sweating a lot, and also avoidance. It is when you may become so consumed by this worry that it affects your ability to work, socialize, or complete everyday tasks that you need to stop and listen. So, how can you help yourself? Well, while it is reasonable to be concerned about the coronavirus, there are simple and effective steps you can take to help to take care of yourself and the people around you. And there are pretty much seven ways that I'll be talking tonight. The first one is really important. Know the facts. Get information or updates from reputable sources. Avoid getting information from social media or secondhand information from people who are not expert in the field. Look at the official government sites. If you are, well, there's the health.gov.au, which is the federal website for the Department of Health. In your own state, you will certainly have the website of your health department in your own state. It's very, very important to check that. For those ones, obviously, students and other people that they are relying on some visa, there's a site of the Department of Home Affairs and Border Control where you can have updated information about those visas. So it's very important to get information from reputable sources so you know really the facts. So know when to switch off. Every day we're exposed to new information or updates about the coronavirus. And we see and hear it on the morning news, on the radio, social media, or conversation with friends, family, or colleagues. So while it's important to be informed and kept up to date, overexposure to this type of content can lead to increased feelings of anxiety or worry. And I myself, sometimes I gotta monitor myself, and my wife, she helps me because the television just talks about coronavirus, and while we are at home, we tend to keep the TV on and we just bombard it with a lot of information. So if you notice yourself becoming more anxious, switch off and take a break from the news to focus on the things in your life you have more control of, like your self-care. Hint number 3, keep things in perspective. People who take care of their health and practice good self-care are more resistant to the virus. And while it's understandable to be concerned about the number of those affected worldwide, it's important to remember that most people who contract the virus make a full recovery. Keeping things in perspective will help you stay calm. But it doesn't really mean that you need to be complacent just because the percentage is between 3 and 4%. It doesn't really mean that you can be complacent. There are severe instructions and advices from our government authorities, and as good citizens and people living in Australia, we need to certainly abide those advices and keep ourselves safe. Hint number 4, avoid making assumptions. Remember, anyone can be affected by coronavirus, regardless of their ethnicity, age, or gender. Avoid making assumptions against certain communities, such as those who originate from countries heavily impacted by the virus. We need to get through this together by being our best selves and coming together these challenging times. Hint number 5, practice good hygiene. Follow official advice and practice good hygiene. Wash your hands with soap and water for at least 20 seconds. We also, the way that we need to wash the hands, it's not just like this. We gotta wash the back of the hands. We gotta wash between the toes, the fingers. We gotta wash between the big finger there, the thumb, and also we gotta wash underneath the nails as well. So it's very, very important. Use alcohol-based hand sanitizer and cover your mouth and nose when you cough or sneeze. So a very effective way is to cover with a tissue, or if you don't have a tissue, you use the elbow technique. It's not a good practice just to cough or sneeze covering with your bare hands, because your hands will be, if you are contaminated, will be with a lot of saliva and mist, and that's a source of contamination. So always have a tissue or use the elbow technique. If you develop flu-like symptoms, see a doctor and avoid work or go to public spaces. And if you're going to the hospital or if you're going to the clinic, it's important to alert the hospital or clinic in advance that you're coming in. They might have some specific procedures for that. Hint number 6 is stay calm and stay healthy. Some adversary reactions include wanting to pull away and avoid talking about the event or the impact it has had on you. Despite this understandable reaction, it can be helpful to connect with others who can support you and talk through your thoughts and feelings, or simply be there to spend time with you. Don't isolate yourself. If you need, there's a lot of help available in terms of a lifeline. I think there's a Blue Care. There's a lot of services that you can ring, and then you can talk to them. And hint number 7, stay connected. Connecting with people around us improves our level of resilience. Although it's not recommended to be in contact with people when you're feeling ill, you can still stay connected by phone, video call, or text message. If you notice that you are feeling worried or anxious, reach out to your friends and family and let them know what you're feeling. It's very, very important to let people know how you're feeling. If you're feeling anxious, especially if you are with the virus. Well, I hope this content was helpful and it can assist you in case of health anxiety during this difficult time. I know that a lot of you probably watching this video and also thinking about the job that you perhaps doing, and you don't know what's going to happen in the future. If you are in the process of validation of your qualification, because there is a visa process, I know that it can be stressful as well. If you're having those issues, send me an email. If you have a particular question about your validation send me your question. I'll be more than happy to reply. Having issues with validation is the least that you need now. We need all to concentrate and stay safe and healthy. But if you are going to self-isolate, perhaps it is a good idea to start thinking about other things to make valuable time while you are secluded at home. So perhaps organizing things, because life keeps going, keeps moving. And if you have to stay at home, if you cannot go anywhere, you cannot work, for example. So why not doing something that's going to help you in the future? And this could be preparing your documentation for your validation process. If you have questions, send me a message, send me an email, and I'll be more than happy to help you guys. And for those ones that are really concentrated, I've got a few messages of people that despite everything that's happening, they are focused on validation of their qualification because they've got deadlines and they've got time frames. So they got to keep going. So next month in April, I will be doing another free validation workshop. The links are in the description of the video, a description in the Facebook. And if you are in Instagram, if you go to my bio, there's a whole heap of links that, and one of them is to register to my free workshop next month. Again, if you have any questions about the validation process, or if you're having questions about your feeling anxious, as I said, I'm a qualified mental health first aider. send me a message and I can put you in contact with professional support. I can put you in contact with other support as well. So if you guys have any question, I'm more than happy to answer any question that you guys have, either about mental health, either about the validation process, any other issue that you could be having. So if not, I will thank you very much for your time. It's 9:22 p.m. here in Queensland, and I wish you all the best. Keep yourself safe. Isolate yourself as much as you can in terms of physical isolation. Get in touch, stay in touch with your friends and your work colleagues. I myself at work, tomorrow I got to go to work, and we have meetings preparing ourselves for this situation, and we're trying to do as much as we can using Skype meetings, etc. So thank you very much, and I'll see you all next Sunday, 9 p.m. Brisbane time, talking about another subject related to validation process or health and safety or environmental. Bye-bye.